For being here. We're of course at the Gateway Center on Gibson and here in the Medical Sobering Center to talk about some really exciting legislation that will leverage opioid settlement dollars to get folks help in our community. So I'll turn it over to the mayor and our team here to talk more about this.
All right, well, listen, we just thought we would pause from everything that's going on, whether it's our country or our city, and just really celebrate some critical funding for our city, and funding that literally is going to fill the beds that you see around you. That's what this is about. But most importantly, it's about who will use those beds, people who need it most, and people who need treatment and addiction help are most in need will now have a home, and we'll actually be able to open this very shortly. So what I'm going to do is actually share a couple of more remarks just in terms of background. Then we have some amazing counselors here who help make this all happen. And then we have a little bit of staff. So we'll try and keep it brisk, but I also just want to thank some folks that are here from our provider community and support community. And I know Richard Gashevsky, I think I saw Richard. Thanks so much for all your work at the first responder receiving area. And that has truly been a godsend for so many people and something that I know we needed in our city literally for decades. And so appreciate your work there. And Patricia Archuleta, thanks so much, for Senior Associate Director at YDI, and YDI plays a critical role in this going forward, so we're very excited for that. And of course, Robert Houtman too. I think I saw Robert, yes, the Program Director, of course, for Heading Home, which does our navigation and respite work. So thank you all for the work that you do each and every day. So I'll just begin with a little bit about, we understand that in many ways all across the country, but also here in Albuquerque, I would argue fentanyl is the biggest problem in America, and it's the biggest fundamental problem eating away at our cities, including here in Albuquerque, and the people that we love and care about. And so the question for us is, what can we do to help? And what we're celebrating in many ways today is another huge step in a journey that has been a long journey. We decided, believe it or not, I think it was before all three counselors were in office, the voters actually voted on the Gateway Center way back when, and the idea was really simple. We can't wait. The city has to step up and build a facility that then professionals can operate to actually get folks the help they need so they can come off the street and get help and stay off the street and eventually into housing. But we know you can't always do that directly, especially if you're suffering from addiction. So that's what this, in particular, sobering space is all about. So for us, the Gateway network as a whole is now up and running. There's still parts that we have to fill. There's still parts that we have to finish, like our young adult Gateway coming up this fall. But we also know that we got to use the spaces that we've invested in and that we've built. And so now that we invested all the funding to set up this facility, we obviously have to fund running it and using it and getting people the help they need right here. So that's what Gateway is a home for, and that's what we're reflecting on today. Now, we also know there's urgency. This project has obviously been a long project. The amazing thing, though, is many parts of it are finally done or almost done. And so now it's time to actually use them. It's kind of like if you sort of get the car and then you get the keys to the car and you actually got to drive it. That's what this is about. It's about driving actually some solutions into our community, and so that people can find a path off the street and into help. We've done, for the most part, the hard work. And so now we just got to put these resources to use. And I always say it's very similar to some basic things like CIP coming online. We're going to build a giant swimming pool in a couple of years, and that's going to cost a lot to run. And this is no different. We built this facility, and so now we got to use it, and we got to fund those operations. And we're able to do that here today, in part because of our counselors who have never given up on this project, who fought through everything in between, whether it's asbestos or, first the community didn't want it, now they really want it. They want it like even more than before all of a sudden. And so that's also why we try and expand it. And we remind everyone that this is also for all of Albuquerque, right? The answer to seeing fewer people on the streets is to get them help and transport to a place where they can stay and eventually find housing and support for recovery. That is the Gateway system. So this is truly something that City Council has done for the entire city, no matter where the district is. There is no question that this city actually helps people be able to find help from all over Albuquerque. So what we have here today is, of course, $1.4 million for first responder receiving. We got about $1 million for gateway recovery, which is out at the old DMV, our container pallet community for peer reinforced recovery. And then, of course, about $2.25 million for the medical sobering center right here, which will be able to serve about 50 people at a time and 24 hours a day. Another gap that we'd had for decades in our city, now we'll finally be able to fill. So I think with that, I would also just say, we want to keep doing this. And the reason when I say doing this is because we're going to have more beds available here at the end of the summer and the fall. And so it's up to us to make sure that we can actually get folks the help they need through utilizing that space. And so there's more challenge ahead with respect to funding, but we've done the hard part, and so now it's actually time to help people, and we can do that right here at the Gateway. So with more, I don't really have an order, and so, but I think Councilor Feeblecorn was our sponsor, so I'm going to start with her if you want to share any words. Did I get that right?
Yeah.
Okay, good.
I think I was a sponsor of one of them. So
they're all
I'll
co-sponsored.
talk. There's been a lot of work on this opioid settlement funding. So first of all, I just want to say how happy I am to be here and to see this opening up. This is such an important thing for our community. And I think that, it's been a long time coming and it hasn't been an easy road, but I think we're going to see payoff. We're going to see the ability to help people in this building and in these various parts of the building really soon, and that's incredibly fulfilling. I do want to thank all of the co-sponsors of all of the legislation that have to do with the opioid settlement, because that was myself, Councilor Grout, Councilor Rogers, and Councilor Champagne, who worked for a period of about 2 years to go through this process of getting community input, finding out how those funds should be used according to the community, which is what they were for, and then coming up with a plan that allows us to move not only this project forward, but the Gateway Recovery Project, as well as a lot of projects for our local nonprofits. And so I'm very proud of that work and the result, and I'm just excited to be here today to see it really starting to take off, and I'm going to be more excited when these beds are filled.
Mm-hmm. Councilor Grout?
Thank you, Councilor. I too am very excited for it to be opening. I can't wait to see people use the services and get help, and I think it's the first step, and you get them here, they feel better in 24 hours, and they might be more apt to receive more help, and that could be the first step in that recovery, and I hope that this place is booming with people, that's what it's for. And I look forward to people receiving that help and the people that are going to serve them too.
Very good. Mm-hmm. Councilor Rogers?
Thank you, Mayor. Thank you just for having us here and inviting us. I think this is, for me, my first year in office, being on the local government coordinating council, which is made up of councilors and commissioners, was a lot for a first year.
Yeah.
And being charged with working with this group to put together a plan that is really rooted in community. And you all know I'm very, vocal and hard on HHH because the need is so great, not only in District 6, but across the city. And so I know that we are this is just one more step in connecting all of the hard work that this team has done for years to get this to this point. And I just have to say, we are at the precipice, right? We are right there. And things like this coming online are just going to help us really meet people where they are and connect them to the help so that they can get to self-sufficiency. Because that's the goal here, is to, connect all of these dots so that we can really help folks help themselves. And that's really, for me, what this is all about. So I just want to say thank you. Thank you to the team. I am always really hard on HHH, but this is a day of celebration. And they do work hard. Just have to say thank you to you all and your team, because it is a lot. And so just keep it up. Let's go. Let's help people and get this whole building filled.
Yeah.
Not just this basement, all of it.
So that is a great segue, actually, into our next couple of speakers. But first, because we want to hear from Triple H and also just some of our community providers, and we're fortunate to be here with Jennifer Burke from Serenity Mesa. So we want to see if you want to share a few words, Jennifer.
Sure, absolutely. Thank you for having me. Jennifer Burke, I'm the Executive Director of Serenity Mesa Recovery Center. We're a youth recovery center that's located in the South Valley of Albuquerque. And this funding is very personal for me. I lost my son in 2011 to an overdose. He was a direct casualty to why these funds exist in the first place. And he was overprescribed opiates when he was 16 years old. He continued to receive those prescriptions without any education or any knowledge about how addictive they were, and ultimately ended up losing his life in 2011 when he was 18 years old. So this funding, that's where that came from, is really from the lives of thousands and thousands of people who received opiates without any knowledge of how addictive and how dangerous they could be. They serve a very valuable purpose in life. They are really good at pain management, and there is a purpose for them, but they can also be very addictive and ultimately can cause death. And so that's why this funding exists, is because there was no education out there. And since then, there is a lot of education, and the doctors are providing more information. And this lawsuit, it's New Mexico received a lot of funding from it. Other states received a lot of funding, and that also increases the information and just the knowledge that we need to share out there in our community. Because the mayor's right, fentanyl is a huge problem right now, and we created a world of people that were addicted to opiates, and when they couldn't get their opiates anymore, fentanyl was there waiting for them. And then fentanyl stepped right in that door and unfortunately caused many more deaths because of how potent it is and how deadly it is. So I'm fortunate. We've been involved with the city for a very long time with our program. They support our program, the city councilors support our program, and I'm excited to see the Sobering Center open. I'm excited to see the gateway services expand, and we've been a great partner with the city, and I look forward to continue to work with them.
Thanks so much, Jennifer. Speaking of doing the work in this space, in addition to what Jennifer does each and every day, it was 10 years ago, if you think about our city, we didn't even have a department or office that did anything around homelessness or around addiction. In fact, we created that, and it was over time. It was first a division, then it was its own department, and now we have HHH, the Health, Housing, and Homelessness Department. And they're supported by a lot of folks here, whether it's Charlie in the back or Jennifer, who do this work each and every day, Carla, who's the boss in charge. But I think that brings us to, of course, the director of that department, who is himself a clinically trained social worker, and someone who, as Councilor Rogers kind of alluded to, when the number one problem in our city is addiction and related either tragedy or homelessness and so forth, the number one person who people complain to is the head of that department, which, for better or worse, we created. But it's a way of just expressing our gratitude for the people who actually do this work every day. The providers that are here, the folks at HHH, and I think, there's always a debate between the police chief and the head of HHH, who the city cares about the most. And so, no pressure, Gilbert. But we very much appreciate all he's done. And of course, this is part of a vision that he outlined with me now many years ago, when I said, what do we have to do to actually build a system, to do the real work, not just a press conference or not just a pilot project. What do we have to do to build a system that will help Albuquerque for generations to come? And this was the whole gateway structure, in many ways, was Gilbert's vision. And so let's hand it over to our director, Gilbert Ramirez.
Very kind, Mayor. Thank you. And thank you all, councilors, as well as Jennifer, your story and just your fight. It's an honor, really, to sit in the position. When I was asked to step in as director, a lot of folks were like, are you crazy? Like, this is some really hard problems to solve. And I think as a trained social worker, solving problems is what we try to do. And we know we can't do it in isolation or alone. It's in partnership with clients as well as our community and others. I remember, and Jennifer's being very modest, when Jennifer came to us and we knew that a while back the only public youth detox program in our state was shut down. And she came with not only a wonderful idea to say, let's reopen it, but how do we do this in partnership? And I can say now you have beds available for youth detox. It took a vision and partnership to say there's a gap. And when you look at systems of care, adult systems are very different than systems for youth. And the two have to be set up, right? And they have to be ran differently. And so Jennifer came with that. We fought and it took time. We had hurdles, and now it exists, right? And so it just shows the power of community to be able to address so that, others don't have to hopefully experience, what you've gone through. And that's that fight and that plight. I had the honor of sitting at the recovery housing as we were giving a tour. That's a very innovative program. It's the first of its kind in the state, right? 50 spaces, 46 pallets dedicated to sober living that we know the research shows. If you can put someone in sobriety for 18 to 24 months, they're less likely to have a recurrence and be more successful. But where does that place exist that you can access because everything's full? And I was there where they took in their first client. So that week, it was the first client who came in, was very persistent, called every day, shared their story of finishing detox and now needed that next level of care. And the investment of the funding going into a program like that again, it's first for our city and first for our state. That's innovation, that's building a system of care. The recovery center, this was done in part to support our first responders. It was me sitting with the fire chief and her saying, we're responding to thousands of calls a year in which we take inebriated individuals to the ERs, EDs, and or PD takes them to jail. And that means it's a bed less for anyone here to go in and get a doctor to see them because. And then fast forward to like last year, I was there with my wife at the ER and sitting there, and there's an individual they carted in and he's in a chair and literally vomiting in that chair in that space because that is your detox and or recovery sobering center. It's the hospital. We can do better, we should do better, and that was part of the visioning, that you can't work by yourself when these systems lack. And it was all driven by our community. Our community said, we need a sobering center that's medically oversight. And we said, okay. This building was acquired in April of 21. So short 4 years, we just passed that window. In 4 years, we've stood up all these spaces and programs. They do take time, but in city gov environment, that's pretty lightning fast to consider how quickly you can build out multiple programs and spaces and obtain the funding and bring the community together to align and build that type of system, which just means that we have a lot of dedicated folks who are putting people before politics and what's good for our community, and I can always stand behind that. So that's why I say it's a privilege to sit in this position. It is tough, but you don't step into positions of leadership if you don't expect, to have some pushback. So that comes with it, and in the end, the fight is worth it to know we've got the beds and that our youth will be a little bit better off. Not that we need more. It's not enough. We always need more. And our spaces for recovery housing, we did a feasibility study to show that didn't exist and we needed more spaces. So then let's put the money in there. It's the continuum, right? Where do you come when you first need it? Understanding that addiction, just like some folks who are living with cancer may have occurrences, it's either curable or it's not, or it takes time, right? So where are the spaces that you can enter into to really get the help you need and not have the judgment, the stigma, and then connect you to the next level of service? That's what these funding did. And I go back to, I remember our city lead attorney sitting with us and we were consulting on the lawsuit when we were preparing it to go after the funding. And all the strategy meetings that we had to discuss in behavioral health, what's needed and what's lacking. And then we built the case, and then we fought the case, and then we won the case, and now we have the money. And so with the teamwork of everyone here, now it's appropriated to the areas and what people want in the services, right? So it is our job, get this one open and running, to see people already entering in recovery housing, which is needed. And so that's the goal that we've been working to. It's been a privilege to kind of sit here and kind of be behind the work to get it done in partnership with our community because we know the impact and why it's needed. So again, my appreciation, because this is truly everyone coming together. It does take thought, and sometimes it seems very fragmented, like it's a one-off program. I'm like, no, trust me, they're all connected. And they all do have intentional design, everything from first responder to our rest program and where people go to heal. Those are all valuable programs for the community, and I've had numerous people from out of state saying, how did you do it? I'm part of a coalition that talks about sobering centers, and all of them are amazed at, like, you all have a very well-designed medical sobering center. And I said, well, we learned from you all, because you all taught us what do we need, private rooms, open beds, etc., nursing stations. all well thought out to be able to say, how do we serve our community better? And I will say our community deserves this. They deserve, good facilities to be able to get the help you need, because when you're down and out, the last thing you need is a down and out place to go to and say, here's what you get, because it's just a message of saying you're less than, and I don't believe that's the case. So again, my appreciation. Thank you.
Thanks so much. Well, with that, we should sign the paperwork here. And I think, too, what I'll do is, I know the counselors have probably have their ample share of pens, but save a few of these for, I think, to the providers. So if you're interested, it's a fun little tradition. You sign a bill, you have a little pen, and I always make the same joke, but it's true. These pens look great, and they're terrible. They're very cheap. They're like $1 a pop, but they look great, and they will last for the 3 lines I've got to sign. So, and I know it's May. What date is today? 28. Okay. So I'm going to send one down, and if you keep it if you want it, if not, just pass it down, and we'll save them. Yeah. Okay. There you go. Yeah.
And then one back there.
Okay. Well, thank you so much, counselors and team, and round of applause for getting this one done. I've got one extra for one of the providers back there too, for sure. Well, thank you all so much for coming, and Stacy will take it from here.
Yeah, thank you. And if there's questions, we can organize some pull-asides and do Q&A after. So thanks so